Hello, everyone. Have you ever thought the impact the COVID-19 has had on mental health and access to mental health care services? Well, I'm going to talk about an umbrella review that examines about it. Literatures have shown that there has been increased prevalence and incidence of mental health disorders like depression and anxiety during COVID-19 pandemic compared to pre-pandemic times. However, COVID-19 pandemic has impacted significantly the access to mental health care services. Therefore, there is a need to explore further the impact the COVID-19 has had on mental health and access to mental health care services. The aims and objectives of our project is to synthesize evidence from studies which examined the impact the COVID-19 has had on mental health and mental health care service utilization, and to identify populations and settings which were more vulnerable to mental health disorders and reduce access to mental health care services, and also to identify the facilitators and barriers to mental health service utilization, and finally to identify the solutions and recommendations to reduce the mental health impact and improve accessibility to mental health care services in future public health emergencies. The overview of our project is we are going to conduct an umbrella review using methodology outlined by Joanna Briggs Institute for Umbrella Reviews. We'll identify the studies that meet our inclusion criteria and extract data from them. The data will be analyzed and narrative synthesis will be done, and we will finally be able to identify potential solutions to address the challenges. To elaborate further on methodology, we are going to conduct a systematic electronic database search on PubMed, Embase, PsycInfo, and Scopus to identify relevant studies. The studies will be screened using Covidence and Prisma flowchart, and those studies which assesses the impact on mental health and access to service utilization by COVID-19 pandemic will be included. Both in-person and virtual healthcare services will be included in our studies. The eligible studies will then be assessed by two independent reviewers, and any conflicts will be resolved by a third reviewer. We'll extract the data from the studies using a thematic analysis, and the findings will be synthesized narratively around the overall mental health impact and how the access, what are the barriers and facilitators to access to mental health care services. And we'll also conduct a subgroup analysis to explore the impact of the pandemic on different populations and settings. This is the timeline. Thank you.